In this clip, we'll be talking about the skull's cranial bones. So as you already know, the skull is part of the axial skeleton made up of facial bones, which are located on the anterior side of the skull, and then cranial bones, which are located at the top. Right? So for cranial bones, there are four major types, or four major bones. We have the frontal bone, located in the most anterior part, right above the frontal lobe of the brain. Parietal bones, located a little more posterior, and you have a left and a right parietal bone. And then on the posterior side, we have the occipital bone, right above the occipital lobe of the brain. And then from the lateral view, you can see the temporal bone, right above the temporal lobe of the brain. So these are the four cranial bones of the skull. Now, separating these bones, we have what we call sutures, or lines that represent the joints between those cranial bones. So between the frontal bone and the parietal bones, we have this line right here, the suture that is called the coronal suture, separating the frontal and the parietal bones. We also have a sagittal suture that runs down the length of the skull, okay, or the longitudinal side, and then it separates the left and the right parietal bones. So that's a sagittal suture. Laterally, you can see a suture right here that separates the temporal bone from the parietal bone, and this suture is called the squamous suture. And then from the posterior view, you can see a suture right here that separates the occipital bone from the parietal bones, and this is called the lambdoid suture. Okay.